Good evening and welcome to Healthline. I'm Gregory Zarian along with Suzanne Watley. And Suzanne, I have a question right out of the gate.
What's that?
What do you know about stroke?
Stroke. Well, there's two different kinds of stroke. There's the hemorrhagic stroke, which is the less common type, but also the more deadly. That's when bleeding starts in the brain. And then there is the ischemic, and that kind is a blood clot in the brain, and that one is easier to treat, and recoveries are better.
And also more common.
Yes.
That's very good, Susan. Very proud of you.
And what are the symptoms of stroke, Gregory?
Well, what I love is that it's called FAST. Facial. So if your facial expression is drooping. Arms, if you can't raise your arms above your shoulders. Speech, your speech is slurred, and then time. Because if you or someone you love is suffering from a stroke, time loss is brain loss.
That's right. And sometimes people don't even know that they are having a stroke, or they may be aware of something being terribly wrong, but externally they exhibit different kinds of traits that can be misinterpreted. For example, Gregory, you and I both heard the story of a woman who was thought by the paramedics to be drunk, and she had passed out at a restaurant. And,
she was found in the restroom. She had been vomiting. She passed out. She was found in the restroom, and they thought, as you just said, she was drunk.
Right, and fortunately, she survived her stroke, but it was certainly no thanks to the initial responders who misdiagnosed her. Tonight, we're going to be exploring one woman's personal story of suffering from and recovering from a stroke. Her name is Elizabeth Manaserian, and she is a commercial real estate broker here in Glendale. She's the owner of Vantage Realty, and she is also the president of Glendale Healthy Kids. Elizabeth has been a guest on our show in that capacity in the past. This time, she returns to tell her dramatic story. Thank you so much, Elizabeth.
Thank you for having me, Gregory and Suzanne.
Well, first of all, ladies, you're both wearing purple, and you're covering for me because May is Stroke Awareness Month. So
we're wearing enough purple to compensate for your lack. I can't believe you don't have purple in your wardrobe.
I have pink. I don't have purple. Sorry.
It's such a regal color. I feel a little bit richer wearing purple.
My birthday's coming up. Get me something purple.
I'll do that. I don't know. Get Gregory purple. But purple is the stroke awareness color, so we are attired thusly. And tell us why you have decided to speak out about your story tonight, Elizabeth.
Well, I decided to speak about my story, Greg and Suzanne, is because I think that a lot of people are not aware of the symptoms. They take it very lightly. They don't really pay attention to what's going on with their bodies and their demeanor or physique. So it's very important for them to know what's going on. And also, the other reason that I decided to speak up about my experience is the fact that Glendale Adventist was very instrumental in my recovery, and the doctors in Glendale Adventist were even more instrumental in my recovery. And this is a place where I could really thank the community, the Glendale Adventist, and the doctors for what they did for me, for my recovery. That's why I'm here today, sharing my story.
Well, as you were saying, though, most people don't pay attention to other symptoms.
Right.
And as I've learned before, talking about stroke, I've met a child, the Dinger family, he had a stroke in vitro.
Right.
And no one realizes how devastating it can be. I love my statistics. Every 45 seconds, someone in the United States will experience a stroke. Every 3 minutes, someone dies of a stroke. Over 7,500,000 people will die this year alone, the year 2010, of stroke. And approximately 50% of deaths of people going to the emergency room die in the emergency. They never even make it.
And certainly the greatest tragedies are people who suffer stroke and they kind of brush it off as, I just don't feel good. I'll lie down and we'll see if it passes. Or perhaps people who live alone and they're not able to get to a telephone or get to help before they become incapacitated by their symptoms. And we need to remind people that stroke does take a variety of forms. You mentioned FAST. The facial, the arms, the speech. It can also include just drooling, and severe headache. Elizabeth, I believe that was something that tipped you off. There was something terribly wrong. Was extreme severe head pain.
Right. What happened is I just come back from a board meeting, and I started fixing dinner, and experienced a severe headache I'd never had before. And I knew there was something wrong, so I walked to my bedroom to lie down, and I started not being able to breathe right, and it just, something was wrong. And my husband saw that, says, "You don't look too good." So we went to the hospital and were tested in varieties of ways at the time. And that at that time it wasn't really diagnosed as a stroke. That's another thing, that sometimes it's hard to diagnose it as a stroke. After several tests, it was not diagnosed, and I came back, and the pain started continuing and getting worse and worse and worse. And 4 days later, it was just came to a point where it was just unbearable. And that's the point that I was rushed into emergency and tested in different ways, again, by Dr. Voskanian at the ER hospital, did a carotid CT angiogram, I believe. And that's when they decided that I had a carotid dissection. So that's how my treatment started. So then my story began. So, and my stay at ICU.
We've just begun to tell Elizabeth's story here on Healthline. We're also going to introduce you to the doctor who saved her life. Stay with us. Welcome back to Healthline. Our topic tonight, stroke, and a dramatic story by Elizabeth Manaserian awaits. First though, let's watch her participation in the Downtown Dash. That was a 5K run walk that occurred recently right down Brand Boulevard here in Glendale, and Elizabeth was a proud participant.
Cut! Okay, so that's
Very nice.
Healthline comes to Brand Boulevard and the Glendale Downtown Dash. I'm Suzanne Whatley along with Gregory Zarian, and registration is taking place for this fabulous event, and my co-host here is among the participants. Are you warmed up and ready?
I'm warmed up and ready, number 962, Team GAMC, and also personal team, Team Healthline. I'm ready to go, Suzanne. Ready?
All right, you're going to do it. I'm here with Elizabeth Manaserian with Glendale Healthy Kids, who also participated in the Glendale Downtown Dash today, and she is a stroke survivor.
Because 3 years ago, when the very first Downtown Dash happened, I hoped that I could do it, because a couple months before that, I had a TIA and I couldn't really walk well, and it was really a struggle for me. So I made a promise to myself that I'm going to participate from now on, the second and third year when I'm able to walk, and I'm so grateful to be here today because that promise has come true to myself, and that dream has come true for myself.
So it's very fortunate for you to be at a hospital that's renowned for its
Yes.
ability to effectively treat stroke victims.
Glendale Adventist Hospital Stroke Center was phenomenal. The doctors, Dr. Lee, Dr. Rappard, Dr. Law, Dr. Thompson, phenomenal doctors. I can't really speak highly enough for them and their care level. And the NITU unit, the ICU unit, the nurses, they were wonderful to all the patients and me as well. So it's a special day for me.
Elizabeth Manaserian, thank you so much for talking with me, and congratulations.
Thank you very much. I appreciate it. Thanks.